So we're glad you could join us today. We will be recording the seminar as always, and it'll be posted on our YouTube channel within the next week. If you just joined us, please share your name and organization you represent in the chat box. So if you're not familiar with the Swetland Center for Environmental Health, in the late 1950s, David W. Swetland and Mary Ann Swetland felt that not enough was understood about the unintended consequences of chemical, agricultural, and industrial products in our environment. So they focused the Mary Ann Swetland Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards so that all graduating doctors would have an interest in and understanding of the impacts of the environment on human health. For over 30 years, the Mary Ann Swetland Center for Environmental Health has cultivated partnerships to develop and expand solutions that enhance environmental health for everyone. Our work encompasses various exposures influencing health outcomes throughout life, such as asthma, chronic diseases, mental health, and infant vitality. We're recognized for our collaborative and adaptive approach that transcends boundaries to foster healthy environments where people thrive. And our mission is to accelerate pathways to vibrant and healthy communities, environments through collaborative research, immersive training, and authentic community engagement. We have a three-pronged approach, as you see in the graphic here on the right, focused on research, training and education, and community engagement. If you're interested in learning more about the Swetland Center, you can visit our website, case.edu/Swetland. You can email us at swetlandcenter@case.edu, and you can also visit our link tree, which is linked in that QR code. And we'll make sure to put all of these in the chat, and you'll get a copy of the slides after today's presentation as well with all these links. Okay, we do have a few events coming up that we wanted to share with you all and invite you to sign up for. April 28th is a Tuesday. This event will be in person from 4:30 to 7 p.m. in our building, the Midtown Collaboration Center on 66th Street in Cleveland. So this Environmental Health Connector event, we're bringing in a national speaker, Dr. Angela Odoms-Young from Cornell University. And the topic of her presentation is hope and resiliency in communities and local food systems. So again, we'll put the link in the chat there. There's still several spots for people to sign up for that. And Dr. Odoms-Young is committed to improving community health and well-being by examining how intersecting systems of oppression impact food access, food security, dietary patterns, and health outcomes, particularly in historically marginalized communities. So we hope you'll be able to join us for that. We're really excited to have Dr. Odoms-Young with us for that event in April. And then the other event we wanted to make sure you all heard about was a workshop on Thursday, May 14th from 12 to 1:30 Eastern, and this will be virtual. Funding for produce prescriptions is the topic of this workshop. And it's free. It'll be facilitated by Kim Hines, who's a consultant on our REACH grant. She's the co-director of the North American Food Systems Network. And she's going to speak about the funding landscape to support produce prescription programs and what funders are looking for in grant proposals. After the workshop between May and August, Kim will also be offering a few one-on-one TA sessions for folks who are either already implementing a produce prescription program or are interested in starting one. So she'll be able to meet with people one-on-one to talk about strategic planning and applying for funding, and can help you with grant applications as well. So we will share more details about the TA sessions in our newsletter, but you're welcome to go ahead and register for that workshop. Okay, so today's panelists, I'm going to introduce, and then I'll turn it over to them to start their presentation. So Dr. Owusua Yamoah is a research scientist and the community engaged research lead at the Mary Ann Swetland Center for Environmental Health at Case Western Reserve University. She received a PhD in spatially integrated social sciences from the U.S. University of Toledo, an MA in urban studies from Minnesota State University, and a BSc in development planning from the University of Science and Technology in Ghana. Dr. Yamoah's work is primarily focused on using community-engaged approaches to leverage the lived experiences of low-resource communities to inform policy. Dr. Darcy Freedman is the director of the Marianne Swetland Center for Environmental Health at Case Western Reserve University. As an applied population health scientist and community psychologist, she is nationally recognized for her contributions to community nutrition. She brings a transdisciplinary background to her research agenda, developing policy and systems level interventions to promote health equity by addressing the complex interplay between public health and environment. So welcome, and I will turn it over to Darcy and Owusua.
There we go. Thank you so much, Linnea. Thank you all for being here. It's exciting to be able to present today because many of you, looking at who's in the audience today, may have been involved as a participant in this research. And so it's exciting to be able to share the findings and get feedback from you about what we found. So today we're going to be talking about gaining consensus on metrics of nutrition equity for urban food systems, results of a modified Delphi study. So our work today is nested within the Nourishing Power Network, which was a community action research project testing ways to transform food systems by bridging community power with organizational power to spark and expand food justice initiatives led by the community. The intervention had 4 components: a fellowship, a fund, advisory council, and networking, and all of those were focused on and led by community members within the Cleveland area focused on food justice. The intervention phase of the study ended in June of last year, and now we're in the dissemination phase. I want to highlight as well the leadership of our team, our Nourishing Power Network study. We took that idea of bridging community and organizational power to the leadership of the team. And so we had both community and academic co-investigators on the study. And I also want to acknowledge that the research I'm presenting today was funded by the Foundation for Food and Agriculture Research and the National Dairy Council. Much of the work is because of partners who have become co-authors on the work, who served on our consultancy panel, who informed the development of our Expert Lens process. And I also want to acknowledge the people who participated in Expert Lens. So sort of grounding in this idea, I know we've all heard it before, the idea that not everything that can be counted counts, and not everything that counts can be counted. And that's sort of at the premise of this study. We're trying to figure out, how do you measure the things that are important when it comes to the goal of what Nourishing Power Network was about, which was, driving community led food justice work in communities to achieve a goal of nutrition equity. Today, we're going to be presenting on, kind of grounding, how do we currently measure the performance of urban food systems? How might we measure urban food systems in different ways? And what are the methods to gain consensus on that? We'll then share the findings of our consensus work and then end with some ideas and really open discussion about what's next. So measuring performance of urban food systems, just to kind of think, and maybe even typing in the chat, what are the most common ways to measure urban food system performance? What are some of the ways right now that we look to these measures to say the urban food system is doing good, it's doing bad, it needs to improve, it's really doing great? What are some of those indicators that we might look to? Anyone want to type something in the chat? And there aren't necessarily right or wrong answers. Okay. Well, one of the ways that we look at urban food system performance is through a measure like food insecurity or food security. So this is a measure many of us are familiar with. These are data over time, 2001 to 2023. And what we can see is that where we are today, or most recently, 2023, is actually worse than where we were when we started to measure the outcome. So I know we're all familiar with the reality that the government has decided not to continue to measure this. And I think some of us in this room may say, yeah, we agree there's a challenge with this measure, but it might be going too far to not measure this, at all. Another way that we look at the performance of an urban food system would be through measures such as, how many low income people in an area have low access to a full service grocery store within a certain distance. So this is a map coming out of the Food Access Research Atlas, looking at access in these areas within the half and 10 mile, and all of the orange areas are census tracts in the greater Cleveland area that are low income and low access at the half and 10 mile. And in our county, that's almost half of all residents in the city of Cleveland. So how do we shift our measurement goals? Those indicators that I just presented on food insecurity and food environment measures are population measures, and they're structured by complex dynamics. The reason why we have food insecurity in a community or why we have limited access to grocery stores is not because of one thing, and so many things are blending together. And because they are part of these structured systemic dynamics, they're quite resistant to change. And that, when you look at those trend lines over time, we can see that food insecurity doesn't really change substantially over very long time horizons. And we also know that these community indicators are what the system is designed to achieve. So the way that the system operates, at least 1 in 10 Americans will be food insecure, and those trends are more likely in certain areas or certain populations. Another way to think about measurement is to move toward key performance indicators. And these are used in many fields to show you the steps involved in implementing change. One of the benefits of key performance indicators is they focus on early signs of progress that could signal the direction of how things are moving. And they also allow for agility based on shocks, drivers, and different outcomes that are emerging within the system. But as we think about new measures or possibly thinking about key performance indicators, you have to consider tensions related to measurement. On the one hand, when we put forward measures, they can promote opportunities for transparency, accountability, and even transformation if we are measuring the things that are leading to new outcomes or better outcomes. But on the other hand, if we come up with new measures and we don't have buy-in for their use or acceptance, as well as they don't have methods that are easy to use, so they can't be widely adopted across groups, the benefits may be outweighed by those risks. So in this study, our main research question was, to what extent is there consensus among urban food system leaders, and this was from a national sample, even though our prior work is based in Cleveland, on the relevance and measurement feasibility of 15 implementation mechanisms of nutrition equity in urban food systems. And so now I'm going to jump into the methods that we use to gain consensus, and this work was conducted between October and November of 2025. So the method that we use is called Expert Lens, and we directly contracted with RAND Corporation for all of our data collection through the Expert Lens process. But the first step of our work was to generate implementation mechanisms of nutrition equity. And we did that through a two-step process. The first thing that we did is we looked at qualitative findings about what were the steps involved in community-based or community-driven food justice work. And the data for that were derived from people who participated in the Nourishing Power Fellowship in two different cohorts. So you can see here, these are the two cohorts, and these cohorts were part of the Nourishing Power Network. And from there, and we actually have published paper on the findings of this, we identified a spectrum of indicators of what it might look like to implement community-driven food justice work in urban settings. We then took that information and we worked with our consultative team to refine that list into a set of 15 implementation mechanisms. And once we identified all 15, we then went through our second step, which was convening the expert lens panel. And this was conducted in 3 rounds. So in the first round, everybody came to an online portal, and they had 15 of these implementation mechanisms, and they answered 2 questions per mechanism. They gave an initial rating, and they also could provide feedback. The second round was and everything is anonymous when people are presenting. The second round is a deliberation round. All participants were invited to come back in, and during this round, they could see how did they rate each of the mechanisms, and how did that compare to the average of all the other people rating these. And they had the opportunity to comment and learn from each other during that deliberation phase. And then the final phase, everybody came back in with the same implementation mechanisms, and they re-rated those. And so they could either say carry forward my response from round 1, or they could change their response. And ultimately, we landed with some of those 15 that had positive consensus and some of them that had moderate. And we'll share a bit more about that in a minute. So when folks came on into the Expert Lens platform, they answered 2 questions per mechanism. The first one was, how relevant is this implementation mechanism in advancing nutrition equity? And the second, how feasible is it to measure processes or outcomes of this implementation mechanism? And all of these were on a 9-point scale, with 1 being not at all and 9 being very. And then when we look at these, and you'll see when Owusua talks about this later, we categorize responses into 3 tertiles. So the low level, people who responded 1 to 3, the moderate 4 to 6, and then the high level 7 to 9. And after every question, participants could provide brief rationale for why they responded. And then during the deliberation phases, everybody could see all of these qualitative responses. When people were participating in the study, we did define nutrition equity as having freedom, agency, and dignity in food traditions, resulting in holistic health, so healthy body, mind, and spirit for people and communities. Something we think is really important to highlight about the method is that it did foster engagement. So the idea that people were coming in and having a conversation within this online portal, 95% of all participants commented on at least 1 item during the data collection process. And on average, 26 comments were made per participant. And in total, there were 969 comments across the 3 different rounds of data collection. So even though the quantitative scores, the ratings, were the primary data for us, there was a lot of conversation happening that was influencing how people thought about those ratings. So let's talk a little bit about what are these implementation mechanisms to achieve nutrition equity through community-driven changes in urban food systems. Again, we had 15. And these are the series of actions involved in getting community-driven changes to advance nutrition equity in the urban food system. So we're sort of getting at here, how do you do A that might lead to B, which might lead to C, which may reinforce A, and so on and so forth. So when we talk about mechanisms, it's important to recognize that we're coming in thinking that these things are interconnected. You're not going to just do one thing or another, that you have to start to see how these are connected over time. Although when people answered questions, they were rating them each individually. So as I mentioned earlier, our work is informed by our prior research working with our participants in the fellowship. And you can see from that work, we identified a framework for thinking about mechanisms of implementation for realizing nutrition equity through community-led actions. And these are focused on different dimensions of a project. So you may be in a planning phase or a doing phase, a reflecting phase, or an activating phase. So we have 15 total, and I'm just going to read one line all the way, but I'm going to read each of the mechanisms just to bring them into the room. I don't think anyone will remember it, but just so you get a sense of what people were thinking or what they were responding to. So the first one here is strengthening relationships. So this would involve performing activities to establish and strengthen relationships among community and organizational partners to support community-led food justice initiatives. The definition here, as well as the short name, these were finalized with our consultative team. So it took a lot of work to sort of synthesize what's the essence of this idea. We also had nurturing leadership capacity, team building, securing resources, developing and testing ideas, raising awareness, transforming narratives, cultivating community connectedness, tracking progress, increasing community ownership, increasing economic opportunity, improving holistic health, building enduring foundations, sharing lessons learned, and then initiating policy action. So again, these are those series of actions that might be involved in implementing community-led food justice work to advance nutrition equity. I do want to highlight one of these definitions, increasing economic opportunity, was changed from round 1 to round 3 based on feedback that was happening during the deliberation phase, round 2. And so this one was refined to say perform activities to improve community and individual economic security and wealth building in ways that reduce risk for gentrification and displacement. And so that was the only one that changed from round 1 to round 3. Our goal was to have different perspectives informing the development of these measures. Again, thinking back to those tensions, in order to move forward with measures, we need buy-in from a lot of different groups. So the groups that we engaged for participation were groups we felt like we needed buy-in from to move forward. So the first group were advocates for local food systems, and they may advance use of these mechanisms through policy action, campaign development, coalition building, and influencing. The second were institutional leaders engaged in local food systems, and they might use these to guide decision-making, funding, investments, research, evaluation, system-level programs. And then the community-based leaders that are most proximate to implementing local food justice work, and they may use these to guide program delivery, program innovation, community action, and collective impact. So in total, we invited 207 people to participate, and we did this by working with our consultative team to think about who all are actors in these 3 different groups that we should be reaching out to across the United States. We did web-based or email-based recruitment. In total, 59 people consented, which was a 29% response rate. And then 40 of those, or 73%, participated in at least one round of data collection. And people that participated could opt into the compensation, which was $25 after each round. And if they did all 3 rounds, they did receive $100. When we talk about consensus, we're not saying that it means that everybody agrees about something. So consensus can mean areas where we have agreement as well as disagreement about the relevance and feasibility to measure those implementation mechanisms. And we broke these out into 3 levels. High would be a median score on 1 to 9 of 6.5 or higher. Moderate consensus was median score of 3.5 to 6.5, and then low consensus is a median score of less than 3.5. And now I'm going to turn it over to Owusua, who's going to share our findings.
All right. Thanks, Darcy. Here you go on the next slide. So overall, a total of 40 people participated in at least one round of the expert lens. In round 1, we had 39 people. Round 2, we had about 31. And then in round 3, we have 28. And most of these participants self-identified as institutional based experts. Majority of them also self-identified as women and white. And as you can see at the bottom, participants were from all census regions of the United States. So again, although our initial work were focused on in Cleveland, for the expert lens, we did get feedback across the entire country. Next slide, yeah. So during round 1, we collected feedback from these experts about how they were rating the relevance of these mechanisms. And as you can see, majority of these comments were on mechanisms that they considered relevant. And in reviewing these comments in terms of relevance, we found that a lot of the feedback were really related to the idea that these mechanisms drive lasting and transformative changes. So here's an example of one on a mechanism on transforming narrative. One expert says that changing mindsets and understanding is such an important component of this work, not only for building community support and buying, but also for policy change and advocacy efforts, right? And then in terms of mechanisms that were rated as moderately relevant, when we look at the feedback that we got from experts, they were mostly about the fact that these mechanisms were impactful, but they felt required other conditions or other things to be in place in order for them to achieve their full impact. So again, on developing and testing ideas, one expert says that although this is important, she thinks it's more than what you are doing. It is how you are doing it and who is doing it and who you are learning from that will lead to nutrition equity. And then finally, for mechanisms that were rated non-relevant, a lot of the comments were about the fact that some of them were unclear or vague or too broad for them to really think about how relevant they will be. You're going to go on the next slide. So yeah, we just wanted to hear from you. What do you think out of the 15 implementation mechanisms, how many of them would you think had high consensus by the final rating? You think all 15 or 14 or 6? 6? Thanks, Shannon. Okay. And relevance. 6. Okay. All right. Oh, 6 is winning. Okay, 14. Awesome. Well, that's you want to go on the next slide. So for relevance, yeah, about 93% of the mechanisms were had a higher consensus on relevance. So 14 out of the 15. Go on the next slide. So similarly, when we look at the measurability, we also gathered feedback from experts about the measurability of these mechanisms. And for these comments as well, majority of them were about mechanisms that were measurable. And for highly measurable mechanisms, some of the feedback that we got were the fact that, those were really easy to measure. A lot of them said there were tools that already existed for those mechanisms they thought were measurable. So here's one expert says that like for securing resources, the expert says that measuring the quantities of resources obtained is more feasible than specific outcomes for individuals who participate in these initiatives. When you think about mechanisms that were rated non-measurable, a lot of the feedback that we got were that some of the definitions for mechanisms like increasing economic opportunity or holistic health, they felt were too broad and would require a much clearer boundaries to allow for consistency in measurements. So those were reasons why some of these were ranked as not measurable. I'm going to go on the next slide. So here again, among the 15, how many of the mechanisms would you think had a higher consensus on measurability by the final rating? Okay, 6 again. 14. Thank you, guys. All right, Darcy, you want to go on the next slide? So yeah, out of the 15, only 40% had a higher consensus on measurability. Well, so I mean, we do see that there was greater agreement among experts on the relevance of different actions involving advancing nutrition equity. But then when it came to feasibility to measure, there were, there were fewer mechanisms that were thought of as being measurable. So right, not all that counts can be counted, right? So there was mechanisms that were considered relevant, but didn't have consensus on measurability. And again, it's important to really think about these things because although they may be relevant, when we do not have agreement on how to measure them, that really could affect transparency about the process and these measurements. It could also diminish understanding of how of the change and also limit accountability. Go on the next slide. So here are the 5 mechanisms that had higher consensus on relevance and measurability. So securing resources, developing and testing ideas, tracking progress, sharing lessons learned, and initiating policy action. Go on the next slide. And for each of these, sorry. For each of these, based on the feedback that we gathered, experts provided ideas on how to measure some of these mechanisms. So for securing resources, experts shared that if we want to measure inputs, we can track resources and funds that have been secured, donations that have been received, number of volunteers that have been recruited for food system efforts. In terms of outputs, we can track number of initiatives that have been launched, events held, and meals distributed. For initiating policy action, expert shares that the number of testimonies about policy activities, the number of meetings with policymakers could all be ways of tracking policy action within the food system. When you think about developing and testing ideas, we had that number of pilots that have been launched, could be a way of tracking number of listening sessions with partners on pilots, and also results from pilots, documentation on best practices from pilots could all be ways of measuring and showing progress when you think about developing and testing ideas. In terms of tracking progress, especially that we could measure inputs, we could measure outputs as well as outcomes. And some of the examples were tracking total dollars that are raised to implement activities, participation in activities, as well as number of action items accomplished as part of the project. And then finally, sharing lessons learned, especially that tracking count of dissemination activities like meetings, presentations, participation, and lesson sharing activities could all be ways to track. So again, for the ones that were relevant and measurable, there's already some ideas on how to measure and share progress in these outcomes, in these mechanisms. And I'll turn it over to Darcy to share more about what's next.
All right, thank you, Owusua. So moving forward, again, this is really open forum conversation time, but in our view, we think that there is some evidence to standardize the 5 what we would call low-hanging fruit opportunities as key performance indicators. Of course, and these were the 5 that Owusua just shared. So they're highly relevant and they're highly measurable, and the national level consensus on that. But we would need to do this, standardization with community partners, have to really think about accessible data systems and feedback loops to guide shared learning and adaptation. So you're not just collecting these, but how can they be used to guide practice? So some of the things that we're starting to think about, again, opening up today to conversation, is are there technology innovations for doing this? Is there a possibility? Not saying that we think it is possible, but should we explore AI integration opportunities, as well as capacity building strategies? So if we come up with KPIs, how will we make sure that groups around the country would be able to collect the data? In addition, we feel like, as an example here, we started off in the beginning showing you how we currently measure these indicators like food insecurity or food access. And hopefully, if we started to measure more of these in a standardized way, you wouldn't just see maps of the problem space, but you could actually see maps of the solution space. So again, this is completely hypothetical data, but just imagine if you could see a map like this and you could find an area that was really high on nutrition equity, and you could tap in here and learn about that they launched 3 food justice projects, and they passed 1 policy, and they released a best practice report. And so you could come in and figure out how people are moving forward in the solution space rather than just defining problems that might be existing. In addition, as we think about moving forward, we do think it's important to gain consensus on measurability of the most highly relevant implementation mechanisms, even if they're not considered to be measurable yet. And again, as we move forward with this, it will require engaging the right kinds of partners. This is definitely a team sport kind of opportunity. That in some cases, as Owusua mentioned earlier, we may need to refine definitions of the implementation mechanisms if they're too broad, or need to be context-based, having context-based enhancements. And then also looking at different measurement options. Some of them, in the comments, people noted there are ways to measure this, but it's so complex that it wouldn't be able to be used at wide scale without engaging, experts who can do social network analysis, for example. So how do we make this happen? We're not really sure, but that's something we're interested in talking about today. What is the ideal format and process for gaining consensus on these highly relevant implementation mechanisms, to make sure that we are promoting acceptability and also incentives to spur adoption and use of these KPIs. So just to highlight, what were the implementation mechanisms that were highly relevant but not perceived to be highly measurable, which were so they weren't included in those other 5. There were 4 in this category. So 1 was around building enduring foundations, and this was actually rated as the second highest, most relevant, and this is performing activities like infrastructure development, network building, policy action, share resources to sustain multiple community-led food justice initiatives, increasing community ownership, perform activities to ensure that people with lived experiences related to food system injustices are actively leading work or own space needed to improve the local food system, increasing economic opportunity. We talked about that one earlier. And then also strengthening relationships, performing activities to establish and strengthen relationships among community and organizational partners to support community-led food justice initiatives. And the other 2 that were in the most highly rated were securing resources and initiated initiating policy action. So those all had a median score of 9, which is the highest score that you could get in round 3 ratings. So with that, we're going to end our formal presentation because we knew that we would have this amazing group in the meeting today, and we wanted to open it up for questions, conversation, reflections, especially if you were a participant and wanted to share some thoughts as we move this work forward. So thank you. And Linnea, we can open it up to questions.
I did see Shannon had asked, and I don't know if you had already gotten to this, Owusua, but was there an overlap, like highly relevant and highly measurable?
The last 5 that we shared, those were the ones that were highly relevant and highly measurable. So those 5 are the ones that like finally had higher consensus on relevance and measurability. So we did have, so out of the 14 that were relevant, about 9 of them did not rank as highly measurable. And then the 6 that were highly measurable, 1 of them didn't rank as highly relevant. So the overlap is just those 5. Does that answer your question, Shannon?
And Tanya shared it would help if you follow urban farmers in Cleveland.
Yeah, and I see Tanya has her hand raised. I don't know if you can allow her to share her comment there.
Sure. Yeah. Let me Okay, you should be able to come off mute, Tanya.
Hi, can you hear me?
Yeah.
Hi, everybody. How you doing today?
Good. How are you?
Good. I don't know how I got in this meeting, but I'm here. Thank you. I'm an urban farmer here in Cleveland, Ohio, and I have a lot of hats that I play here in Cleveland. I am on the board for Central State, Cleveland State, and Ohio University for Agriculture. I'm also on the board for the police department in 3rd District, and I'm also the vice chair. I just became the chair for the United States Department of Agriculture. Saying all of that is everything agriculture in Cleveland, that's like my baby. I'm having a town hall this coming Friday at the Cleveland Foundation. I've been doing it for the last 16 years, called Urban Farmers and Gardeners with Town Hall for everybody. So ever since COVID, it seemed like my phone ring off the hook. Everybody wants to learn how to grow food. They're scared of the food that we're getting in the grocery stores. More and more people are going to the hospitals, getting blood pressure medications. So some of the things that I do is I teach our community, I teach our summer youth in the summer how to grow food, how to do it. And so we can stay out the hospital, so we can meditate and relax and all those things you guys are talking about. With the exception of doing the workshops and speaking at different facilities, I'm also involved with policy change. They changed the laws in Cleveland for for the zoning, what you can do, what you can't do. And so I was a part of that. It's like some of the laws haven't been changed since the 70s. And when it comes to urban farming here in Cleveland, we want to buy our land. We don't want to lease our land. So all of the stuff you guys are talking about, I try my best to get involved and get more people involved because it's so important. So thank you.
Thank you so much, Tanya. And I think one of the reasons why we are doing, or we're motivated to do the work here with these metrics is exactly for what you just said, is there's so much happening on the ground, but you wouldn't know that. There's no place to, I mean, you'd know that when you talk to people like you, but there's nowhere for somebody else around the country to be able to say, what's going, I want to learn, like, where are people really moving the needle? That's not systematically available. I mean, you could go online and find out where there's food insecurity, find out where there's food apartheid, but you can't really see how people are working in the solution space. And so that is sort of what we're hoping as these measures move forward, that there is a platform that would allow people to see that solution space and learn from each other and share experiences. So we also, I think the other side of it is not get held accountable to a metric that's unlikely to change, which, let's say, food insecurity in a short period of time. So, a lot of groups are held accountable to a metric like food insecurity, and it's like, oh, well, 12 months later we gave you a 12-month grant and you didn't solve that problem, so change course, do something else. And then every year you're like constantly changing. And so that, hopefully with these KPIs, or the idea of KPIs is we can show what are the steps involved that show changes happening. So you don't have to keep shifting course and you can actually
Yeah.
realize those benefits. So yeah, I'm glad you shared that because I think it reinforces why we did this work.
Yeah, we also have I'm also involved with food fair and Sovereignty Cleveland, and recently we just had a map drawn up, and I think OSU Extension also just had a map drawn up of all the urban farmers and gardeners in Cleveland. So that we've had over 400 plus, but some of them are not active. So we've recently got a more accurate chart of where the gardens and farmers are, where the food is, because a lot of, like myself, I started off 15 years ago, and the first time I started growing food, I wanted to do a farmer's market. But then after 2 years of all hard work and putting up tents and stuff, I'm like, I'm good. So I just let the community know, if you want some tomatoes, come and get them. So yeah, so thank you guys for doing that. It's good to keep an eye on where everything, what's I can say, where's the improvements. Because when it comes to, like, for example, at my town hall that's coming Friday, I know some of the main questions people always ask me is, where is the funding? Where's the funding so I can expand my farm or expand my garden or do something more positive? Or how do I get the summer youth kids to come and work for me? And how do I do all these different questions? So we try to have resources available for them and people that's actually involved in that different departments to come and speak and talk to them about that. But the one thing that is still a thorn in all of our side, those that has been there for a long time, is, for example, if someone says, oh, this agency or this company has a grant for urban farmers, and then you go on that app, on that website, and find, yes, it's true, they do have a nice grant for you. You start to look at the instructions and you look at the application and you realize, oh, this is not for me, this is for a nonprofit. And I try to explain to people in Washington, D.C. when they come and talk to me, or the people at the top when it comes to changing, making policies, stop telling people, oh, we're going to support urban farmers. But when they go on your website to get the benefits or the resources, it's for nonprofits. We're for profit. We're LLCs. We're small businesses. And everybody that's in the nonprofit area, they're not in the farm. They're not teaching. They're, you know what I'm saying? And so it gets a little tricky when people from the top, including Washington, I've spoken to, that says, oh, we have plenty of funds for you guys. But then they go on there and they're like, I don't have a nonprofit. So it cuts some people off right away. So I try to have different organizations understand rural farming is different from urban farming, and the policies have to be changed to fit our neighborhoods. So thank you.
Thank you, Tanya. I
You're
see
welcome.
Kim Mozaleski. Do you want to go ahead and bring her in, Linnea?
Sure. And then we've got 2 questions in the Q&A too. So unmute Jen here.
I think I'm unmuted now. You can hear me.
We can hear
Thank
you.
you so much. This question is going to be a hard one to follow after Tanya's comments and the important information shared there. But thank you so much for this presentation, and it's been fascinating to follow this work too. I'm curious to hear about your thoughts on like how local is local. And, when you're thinking about the relevance and the feasibility of measurement, Tanya mentioned, farms within Cleveland, but using Cleveland as an example, is it the city of Cleveland? Would it be neighborhoods within Cleveland? And if you have thoughts on like how local is local. Thank you.
Owusua, do you have a thought on this one?
Well, I think based on like the work that we've done so far, even through Nourishing Power, I feel like the idea of local is mostly defined by the community that you're working with. Because I mean, we've had projects where people think my neighborhood, like that area that I live in, versus like thinking about the whole Cleveland or East Cleveland. So I think it's mostly dependent on who is defining the work that they're doing. Because I know we even had some conversations about local food system leader. Who is a local food system leader? Does the person really think they are local food system leader versus like an urban food system leader or like a leader in the whole Cleveland food system? So yeah, that's my initial thoughts.
Okay, looks like we have two questions in the chat. The first one is, have you thought of unintended consequences of solutions mapping? For example, an urban area shows lots of food equity projects, so funders decide to move on from that location. This could be a good choice because it's saturated, or a bad one if the community has high need and needs that level and more investment.
Yeah, I think the whole point of unintended consequences for the whole thing, whenever we are talking about measurement, I mean, because it does potentially create transparency, transparency isn't always good, right? It could be that there's some things that we don't want to be seen as clearly, like there's some value in ambiguity. So I think that is an important thing to keep in mind. What are the unintended consequences? Does knowing that this is an area where there's already a lot going on mean people say, well, we don't need to invest any more there? It could also mean we should keep investing. Like this is where there's a lot going on. We're on people's radar. It also could mean like these are the places where we really want to try and disrupt what's happening there because there's so much good stuff going on there, and we don't want to have that happen. So I think those are all things to keep in mind as we move forward with this work. It's a great question.
The next question is, how can these metrics be translated into actionable policy decisions at the local or state level? And what kind of policy have you worked with because of your findings and the KPIs?
I'll give one example, and then Owusua, you could give an example as well. I mean, I think this is the question. What could it look like? We know, I mean, I can just say locally, there are dollars invested at the county level to measure food deserts, quote, food deserts, right? Food apartheid. We could think about an alternative investment where people are saying, let's build the dashboard around, some of the solution spaces, and what's going and highlighting those areas and creating reports about what's going on in that area. So, I mean, that's one example of if these get elevated as key metrics, other key metrics get attention, through policy, whether it's county government, city government, state, et cetera, federal investments to help build infrastructure to see what does this look like. Owusua.
Yeah, for some of the conversations that we've had around this, I think a lot of it has also been around funders, like how can local food system leaders use some of these metrics to show some of the work they're doing, right? Like what Tanya mentioned about like, farmers trying to apply for these grants, and hardly can you change food insecurity in even if it's 5 years grant, right? By being able to show that, yeah, I am, I've been able to secure resources, I've been able to do some of these mechanisms that we have shown to have consensus on relevance and measurability. I think that is one way that we are thinking policy wise, like thinking through like how can these mechanisms be accepted by funders as a way to show improvements in the work that some of our local food system leaders are doing in the community, even if they are not changing food insecurity over the next month or the next year or the next 2 years.
I don't see any other questions in the chat or Q&A right now.
Ooh.
Well, thank you all for being here with us today and for participating if you were involved in that. And we are going to be summarizing these findings and putting them out for publication. There's more that we have. I mean, there's actually a lot more we could be sharing. We tried to sort of hone it in on core findings today, but we are also, if you have ideas about where this should go in the future, definitely reach out because we think there is an opportunity in this work as we move forward. So thank you all for being here with us today.
All right. Thanks, Darcy and Owusua. We'll make sure to get the slides and all the links to everybody as well.
Thank you.
Have a great day. Bye.
Bye.